We need to help people look after themselves, manage their own diabetes. And when there's 40,000 people in Norfolk alone, that gets harder and harder. So what we'd like to do is bring the information people need to them by producing a series of videos, podcasts, vodcasts, so people can dip in and out, access the information on bits about diabetes they want to know about, and learn more when they need to, in their own home, in the library, whenever suits them.
Education about diabetes is really, really important, and I think all patients should have access to education. And the DVD enables people, if they're in their own homes, if they're in care homes, if they're in any situation really where they just need to be able to look up a certain element about their illness, could quickly pop a DVD in and have a look on that. I think that's really vital. Lots of people feel very isolated when they have diabetes, and I think the psychological side of diabetes is poorly represented really. I think it's really, really important and has a huge impact on patients.
Because type 1 diabetes is often very dramatic, people with type 1 diabetes have started insulin the very day they're diagnosed, and they tend to have got a lot of input from day one. So people with type 1 diabetes have seen a dietitian, they've got a specialist nurse, they're probably under the hospital, they may have all sorts of fancy gadgets already. But type 2 diabetes is out there affecting more people, and it's just as bad and it lasts just as long, and so we really want to reach out for everybody else out there who perhaps hasn't had the access to quite as much information. Well, the idea of these films is to be as accessible as possible. If some people will have a question about, a very specific question about their diabetes, say, I'm worried about having a hypo, what does that mean? What can I do to prevent it? How can I fix it? So if you've got a worry about a hypo, you can just click onto the hypo section, watch that bit or download it, listen to that bit. And if that's all you need to know, that's fine. On the other hand, somebody else who's just been newly diagnosed with diabetes, they've probably been given lots of information by their GP or their nurse, and probably 90% of it's gone in one ear, out the other. And when you get home, you suddenly realise, gosh, I don't know the first thing, where do I start? So for some people, they're going to want to really start at the beginning. What is diabetes? How have I got it? Why me? What can I do about it?
There's a very large number of people with particularly type 2 diabetes who've had no real structured education or information specifically about diabetes. And a lot of the education sessions that are offered are very inconvenient. People can't get to them. People have to get a day off work. So we think actually giving education through this route is actually quite a good way of informing people about the diabetes. They can look at DVDs and listen to podcasts in their own time. They can listen to them repeatedly, and to actually see and hear people who've got the same condition talking about what they faced, we think will be very helpful.
So this education video is hoping to enable patients to self-manage their condition more independently.
It's very difficult to change your lifestyle and change your whole approach to the way you're living without involving your partner.
If a child in the class that you run at school, if one of your neighbours has got diabetes and you look after their child every day.
Information about diet and lifestyle and exercise and medication and side effects and monitoring is really important for people's partners as well, and for their family.
I don't care who you are, these podcasts and videos are for you. Not just people with diabetes, so friends, carers, colleagues, they're open to everybody.
We feel it's quite important because it's another format whereby people can access the information, and sometimes to actually see a face to it, where you're actually seeing, you're just talking to normal people. We're trying to put it over in a format where there's not much in the way of what you might call doctor speak, so there's nothing that's really going to go over anybody's heads.
It's very difficult to change your diet and your lifestyle. It's very difficult to lose weight. It's very difficult to really make sure that you take all your medication and manage your diabetes in isolation. This way of giving education is going to be very helpful because it's something you can actually watch or listen to with your partner, with friends, with family. And I think the bigger the network somebody has to actually help them change their behaviour, the more likely it is to be successful, I think.
And there's lots of information to show that actually during a consultation you'll only remember 10, 15% of what's said. Most of it you won't remember. Here, The benefit of these things is you can rewind, listen to them again, you know, throw things at the telly and then go back again, okay, because you clean it up and watch us and listen and learn and go back. What did they say? What did that mean? Or once you've had a consultation, you can go back and say, well, actually, I just want to know why he said that. Why am I on these tablets? So that's why this resource is fantastic.